They're called long haulers, and their condition is known as long COVID. Just because the rate of transmittal is going down and elected officials are now eliminating mask requirements does not mean individuals infected by the COVID-19 virus are home free. Far from it. That's because the chronic effects of COVID-19 continue to plague victims long after they are no longer contagious. COVID-19 causes chronic neurological effects and complications which resemble the chronic effects of other types of brain injury and brain damage. Symptoms such as memory impairment and forgetfulness, sleep disturbances, cognitive fatigue, and yes, even increased risk of stroke and other neurological emergencies are some of the long-term complications that long haulers now have to deal with. If these symptoms sound familiar, it's because they mimic the symptoms and complications following all types of brain injury. Next Wednesday, February 16th, from 11:45 a.m. until 4 p.m., the Brain Injury Association of America, the Albert Einstein College of Medicine, and Montefiore Medical Center are co-hosting a virtual symposium to explore these long-term neurological complications of COVID-19. The symposium will bring together leading experts to discuss Neurological, stroke and other related neurological emergencies following COVID-19 exposure, the long-term neurological effects and the diagnosis of long COVID, rehabilitation of injured individuals suffering long COVID, vaccination issues and government policy and their decisions and their implications. The program was inspired by the work of my partner, Shauna DeCaro, the chairwoman of the Brain Injury Association of America, and Dr. Alan Brook, one of our nation's leading interventional neuroradiologists at Montefiore Medical Center and a professor of medicine at the Albert Einstein College of Medicine. You could obtain more information and register for this program at the Brain Injury Association of America's website, www.biausa.org. We used to say someone in the United States will suffer a brain injury every 21 seconds. Then we changed it to 15 seconds. And recently, the statistics substantiate a brain injury every 13 seconds. With the millions of Americans now living with the long-term consequences of Neurological, we will need a new kind of stopwatch. These symptoms have been dismissed by many, including some professionals and by family and friends, because these individuals may look and sound fine, but you are fully recovered or you're not. If you're not the same person you were before your injury, you did not have a full recovery, and your recovery should not be considered a good recovery. There is nothing mild about a mild brain injury. So please go online at www.biausa.org and register for this virtual symposium scheduled for next Wednesday, February 16th, beginning at 11:45 a.m. If you're a health professional or a certified brain injury specialist, this program is eligible for continuing education credits. Thank you for joining me this week, and thank you Albert Einstein College of Medicine, Montefiore Medical Center, and the Brain Injury Association of America for sponsoring this virtual symposium. I look forward to speaking with you again next week on a new edition of the Brain Injury Insider.